Mrs. Jones. How are you doing today?
I'm good. How are you?
Good. Well, my name's Cassie. I'm going to be your student nurse today. Would you mind giving me your full name and your birthday real fast?
Susan Jones, 2285.
Perfect. That sounds great. So, I see you have your central line. The doctor has ordered for us to go ahead and do a dressing change on that. And then he also wants us to draw some blood from your central line. And then we're going to change the cap on that today. How long have you had your central line?
Oh, about a year and a half.
Okay. So do you feel like you're pretty familiar with how the dressing changes and everything goes?
Very familiar. I get it done almost 2 times a month.
Awesome. Maybe you need that done a little more frequently.
Oh, did I say that? I meant once a week. Every 7
okay.
days, sorry.
Good, because we need it every 7 days is when we're supposed to change that dressing, or unless it gets unless it gets gross. So if I change it today, when's the next time you think it'll get changed?
A week from today, so 7 days from this Monday.
Perfect. Sounds good. All right, do you have any allergies or anything
Nope.
I should know about? Any medications or chlorhexidine or anything like that sounds familiar that you're allergic to?
Nope.
All right. Sounds good. So see, have you ever had any trouble with your dressing changes?
Nope. Not at all.
Perfect. Well, if you do have any pain or anything while we're doing it today, you can go ahead and just feel free to let me know. Part of our procedure today, which since you're very familiar with, I'm sure you know how they go, but I'm going to just explain it to you anyway, is going to be sterile. That's going to be the part where we change the dressing that's right over the top of your central line. Do you know what the sterile procedure means?
It means that it needs to be really clean, and so we don't get any germs in there, so I don't get an infection.
That is perfect. So I see that CNA already put a mask on you, so that's because that's for the sterile procedure. What we're gonna do is, once I start it, I'll let you know. When we do it, I'm gonna have you turn, if you have to cough or anything, turn your head to the left, because that's away from where your central line is.
Okay.
And I'm also gonna have you try and sit really still while I'm doing it, because we don't want to move or anything and mess up the field.
Perfect.
Okay. All right, let me finish getting on my gear here. All right. Almost ready. I'm gonna go ahead and just move my stuff over here. Alright, do a little hand hygiene just to make sure before I put my gloves on. So, whenever someone comes and gives you care, they should do hand hygiene before and after, okay? So can you remind them if they forget?
Yes.
Okay. My gloves on here. Alright, so this part isn't sterile. We're just going to take off your dressing that you have on there right now.
Okay.
So, what we do is we take this little alcohol swab and rub it all around the edges, because that'll help bring it up so it doesn't get stuck so bad. Alright. Okay. You let me know if you have any pain or anything while we're doing this, okay?
Okay.
Alright. So I'm just going to work towards your insertion site here, checking for redness, swelling, any foul odors. Do you have any pain or tenderness around here?
Nope.
Nope, good, okay. So there's no discharge or anything on that. So I can go ahead and toss that. Okay, fix my sleeves here. Alright, so this next part's the sterile portion. You remember what you need to do?
Keep still, and if I need to cough, turn my head towards the left into my mask.
Perfect. Alright. Got all my stuff here. Got my brand new kit here I'm going to open up. Okay. I don't need that, so I could toss that. Okay. I'm not going to turn my back to it, but I have my own gloves right here. Open those up. My 1-inch border here, which is the only thing I'm touching. Okay, go ahead and put on my gloves. Go ahead and step back and make sure I keep my hands above my waist. Okay. Go ahead and get this there. I can fix that in just a second. Perfect. Okay, so I'm gloved up, so I don't need that. Okay. Remember to sit still for me. Gloves in case I need them. I don't need that. Don't need that. All right, so when I get started here, this hand's not gonna be sterile because I'm gonna touch it, but this hand's gonna stay sterile. Got my chlorhexidine, I pop it. I'm gonna hold that down. And then I'm gonna make sure I clean all this area here. Because you want it nice and clean. It's the point of our dressing change here. And I wanna make sure that I get the tubing clean. Make sure that's nice and good to go. Okay, and then I can throw that away. Now I got my Tegaderm to do. Okay, I'm gonna use this finger to grab it and pull it. Pull that off. I'm gonna go ahead and just set that down there. Okay. And now I can use both hands because this part that needs to stay sterile is sterile. Okay. Now I just need to get this off. Let's try down here. Are you still doing okay, Mrs. Jones?
Yep.
Good. That's what I like to hear. All right. Perfect. Okay, no pain or anything?
Nope.
All right, that looks good. And I got this handy little part right here where I can initial and put my name and the date and the time that I did it. That way they know who did it, when we did it, and then we know when to change it again. Okay? I'm gonna put that right there. Okay, and then now I can go ahead and clean up my area. If you need to, if you were holding it closely so that you didn't move, you can relax a little bit now too if you want. Okay, I can clean that. Take off my gloves. Okay, I'm gonna do some hand hygiene.
So what's the next procedure?
All right, so now we're gonna go ahead and do our blood draw. Have you had your blood drawn from your central line before?
Yes.
Okay, so then you know exactly you know what we're gonna do, but I'll still explain it every step of the way.
Perfect.
Got everything I need here. All right. So I'm gonna go ahead and just do a little more hand hygiene just because I've touched a bunch of stuff. And now I'm gonna put on some fresh gloves. Okay. So the first thing I'm going to do is I'm going to clean, actually I'm going to take off your tape because we'll change that out too. Okay, and I'll just get rid of that. Okay. So I'm going to clean your little port here, your little cap, and anytime someone comes to give you medication or draw anything, they should clean it for 15 seconds so that we know it's clean. So if someone comes in tomorrow to draw some more blood, how long should they clean it?
15 seconds.
That is absolutely perfect. Okay, and I'll just go ahead and get rid of that. And I'm going to watch it to make sure it stays clean and nothing touches it. So we're going to start by flushing 10 milliliters of just normal saline. We're going to use positive pressure, which is the push and go method a little bit, kind of start and stop. How are you feeling so far?
Good.
Good? Okay. Alright, I'm gonna clamp it. Take that off. I'm done with that. Now I'm watching to make sure it stays clean. Okay, take that off. And now I'm gonna draw up 5 milliliters of blood, and then we're gonna waste it.
Why do you waste it? I thought you wanted this blood.
So we're gonna waste this first a little bit because we just flushed your line, and so that can dilute the blood that we're gonna draw up, or it can leave some stuff in there.
That makes sense.
Yeah. Alright, so we're gonna clamp our line again. This, and then this we would waste into sharps or biohazard. Alright, so now we're gonna draw up the blood that we need. I still haven't had anything touch our port here, so I'm just gonna uncap here. Okay, and our thing only calls for 3, but I'm gonna draw back 4 just in case. Unclamp. Because we have a littler vial today than we normally do. Still feeling okay?
Yep.
Okay, clamp that. Undo that. That's my needle. Alright. I am going to set this down now, but I'll clean it again before next time. And then I'm going to have my assistant just grab me a, follow me over to grab a vial.
I'll grab a vial.
Okay. My assistant, or CNA, is going to grab me a vial. Thank you, CNA.
You're welcome.
Alright. And I like to make sure I'm clean. So just in case something touched the top of this vial, I'm going to clean it. Just to be safe.
That's smart. I don't want my blood contaminated.
Nope. Alright, we're going to uncap. Go ahead and stick that in there. And then I'm going to just go ahead and fill it up. Perfect. Alright. And then this, I'm going to safe it, and I put in the sharps. This, I have another part, so I'm going to sign it and put my initials on it, and your name, and your birth date, what time we did it, all that good stuff, and then I'm going to give it to the CNA, and she is going to send it down to labs. That way we can get that done for the doctor. Alright, now we're at the last part. We're going to go ahead and change the cap. Alright. So... Alright, so what I'm going to do first before I do that though, is I think I will change my gloves. Just to be safe.
Yep. That's a good idea.
When in doubt, it never hurts to be safe, right?
Correct.
Alright, and what should I do before I put my gloves on and after your...
Hand hygiene.
That is perfect. I taught you well.
You're very smart. You're an awesome nurse.
You're an awesome patient.
Thank you.
Are you still doing good? You don't have any pain or anything?
Nope, I'm great.
Perfect. That's good to hear. Okay, one more glove. Okay. So now we're gonna go ahead and change your cap. The cap usually needs to be changed every 7 days, just like your dressing does, or every time we draw blood.
Okay.
Okay, and we need to take it off after we do blood because there could be some blood left in there, and we don't want to leave that in there because that can cause clots, which is bad. Alright, so since I'm taking it off, I don't need to clean it. I already have my pre-flushed syringe and everything right here. It's in its package still, so it's still clean. I'm going to go ahead and take this off and then get rid of this. While I'm doing this, I'm observing to see if there's any blood there or anything like that. If there is, I can easily take an alcohol swab and clean that up. I'm going to go ahead now, take that out, uncap it, put that in there, unclamp, and then I'm going to go ahead and just flush it again. It's flushing really well. That means it's still nice and clear. Just going to keep using the positive pressure method while I'm doing this.
So what are you flushing this with? Just water out of the sink or what?
No, this is normal saline. It's like what we flushed it with the first time.
Oh, that's right.
Yeah, alright, so then I get rid of this. That's still clean, so I don't need to worry about cleaning it again. This is going to be heparin. Do you know what heparin does?
No, can you tell me?
All right. So we add the heparin in order to make sure that we don't get any clots.
Oh, yeah, I don't want any of that.
Nope, that wouldn't be any fun, would it? All right. So now we're all good here. I'm going to set that down and grab some tape. And we'll tape it up. And you are good to go. All right, do you have any questions or anything for me?
Nope.
All right. Well, I am just gonna go ahead and take off my gloves now. Do some hand hygiene. And I'm just gonna clean up my station. You got your collet, and you let me know if you need anything.
Alrighty, thank you.